Hey guys, hello and welcome to Total Health with Dr. Nick. On today's video, I want to speak to you about something that is going to absolutely affect about every single one of you out there. And if you think you're not going to escape it, trust me, it is going to get you one day, and that is low back pain. Guys, low back pain can be crippling, and if you've experienced it before, comment down in the comments section. Let me know how it's affected your life. But guys, I'm telling you, low back pain is going to affect over 80% of us in our lifetime. So the chances of you getting it and experiencing it is extremely high. But today, if you watch to the end of this video, I'm going to give you the best solution, the best fix to actually fix low back pain. We're not talking about just masking it with medications and other remedies, which we'll talk about. We're actually going to talk about actually fixing the problem and correcting it for good. So that way you are not plagued with this for the rest of your life. Because believe me, I know what it's like. I've had it myself. And for those of you out there, once again, who've experienced it, you know. You don't know if you're ever going to play with your kids again. You don't know if you're ever going to have a normal life again. I've had grown men crying in my office, in my practice, never knowing if they're going to be able to run with their kids or enjoy time with their spouse, or guys, play golf again. And ladies, you know what it's like too. It can ruin your family life. It can ruin your work. We've had patients come to my office who were on the floor for weeks and weeks and weeks, and you know what it's like on that hard floor. Some of you maybe put boards under your bed to get it nice and firm. So you know what I mean by this. So guys, if you like what we're talking about today, please like, share, comment, and more importantly, subscribe to us, so that way you get all the notifications about our upcoming videos. So let's dive into this. And like I said, it will affect over 80% of us. In fact, more even likely higher than that, but it's just about 80% of us will have it at any given time in our country right now. Not only that, 31 million Americans will experience low back pain at some point in their life, and it is one of the highest causes of disability on the planet and one of the highest causes of missed work. So this is something that will not only affect you as far as your social life, but it will affect your productivity. So you want to make sure that you get this problem corrected. And guys, here's the good news. Most of the time it's a mechanical problem or non-organic. So you can rest assured, not worry so much that it's coming from maybe a spinal tumor or something infectious or some type of fracture or some type of inflammatory problem. So most of the time it's a mechanical issue. That doesn't mean it's any less important to take care of. It just means that you have hope where you don't feel like you need to run off to your oncologist thinking you have a spinal tumor. So guys, many of you don't realize where this is coming from, and this is a big thing. In many cases, this is coming from different stresses. Now, I know stress, you typically think of emotional stress, but we're talking about 3 different stresses, the first and foremost being physical stress. So physical stress is the main reason people have low back pain, whether they have falls, whether they have injuries, poor posture, poor sleeping habits, the way you sit at work. Most patients, and I had this discussion with one of my patients just the other day, is that many times in the old days we used to think all these low back issues came from some type of macro trauma, meaning you fell from a ladder, you were lifting a refrigerator, you were moving a couch, you had a car accident. Those are the physical traumas we used to see before, and we still do. But so many of us are experiencing what we call micro traumas, meaning you're sitting at a computer for a long period of time. You're hunched over at a desk. Your job requires that you sit all day long and just destroy those delicate nerves in your low back. So these are all physical issues, obesity, pregnancy, and so on. But we can also have chemical and emotional issues or stresses. So chemical stresses, food colorings, additives, dyes, preservatives, artificial sweeteners, anything processed can be a cause of this. And I know you're thinking, well, how could that be? I'm telling you, physical, chemical, and emotional stress causes tension to the body, and it creates these problems that we're going to be talking about. Also emotional stress. A lot of times you feel this. You have some kind of emotional trauma going on in your life, whether it be a family member or some type of job loss or situation. Next thing you know, your neck and your spine are just tightening up. Well, that's how emotional stress plays into this. So, what are the common things that you do? Well, here's the whole list, guys. You know what they are. You might medicate it. You might use massage. You might use essential oils. You may stretch it. You may try acupuncture or physical therapy. Guys, all these are good solutions. But here's the thing. You have to know the source. If you don't know what the source of the problem is, these will not work. Many times these are more palliative, meaning they're more Band-Aids. So you can't put, say, oils on a spine to fix a physical problem. As much as I think essential oils are important, they're terrific for pain relief. They're not going to fix the physical damage that's within your spine, nor will acupuncture. It might help to reroute the pain so that you're not feeling pain so much. However, if it's a physical problem, meaning a disc, a nerve, a vertebra, degeneration, okay, things like that, this will not work on that. Stretching might just irritate it. So these are great when it comes to a muscular problem, or maybe even physical therapy. Fantastic for muscular issues. But when it comes to the spine, the delicate nerves, the spinal cord, or the vertebra, you've got to look at something else. Maybe you even go extreme. You try a nerve block. The pain has gotten so bad, you can't bear it anymore, and you're thinking, I need to get some relief now, or I don't want to live anymore. I've heard that with patients of mine. I've had patients who have had modulators put in their spines to where the nerve is constantly getting stimulated, or messages are sent up to the brain to be secreting morphine, so endorphins. And so those are many different remedies that people try, but a nerve block many times is injected into what we call the facet, which are the interlocking joints right here. So you can see it's going right into the facet, right where the nerve is, and many times that's cortisone. And you're trying to just block that nerve pain. You're trying to remove the inflammation. That many times is something you may try too. Or worse yet, you opt in for the granddaddy of them all. You just get spinal fusion surgery, where they might go in and remove the disc. They might go in and put cages, rods, screws, and we see this where they screw into the spine and they put the big rods in, just like this. Surgical steel rods, guys. That's what they implant in the spine here to try to fuse the spine together. You're looking for relief any way you can. I know that's what you're doing, but you have to realize there's better ways to do this. There's better ways to correct this problem. And I think many times the other problem we seem to forget, and this is the biggest reason why you want to make sure that you're not just band-aiding this problem. They're not just masking it with a drug, a medication. And many times you know this, you see this, guys. The medications you're taking lead to addictions. And I know you're concerned about that. Many times these opioid-based drugs lead to heroin addictions, or you start to look at OxyContin, oxycodone. And those are highly, highly addictive, and you have to be very careful. But that's because you're not getting to the root cause of the problem. Rather, what you're doing is band-aiding it. Meanwhile, all you're doing is just treating the symptoms of it. And once again, when it gets to this stage, I know you're looking for any kind of help you can. But the key thing you have to realize is this. We just can't take care of the pain. And I know that pain is your biggest motivator. But the biggest thing you need to realize is that these same nerves that come out of your spine that exit out, these nerves right here that come out, they supply organs. And organs are the bigger factor. And that's where I believe other solutions fall short, is they're not addressing the fact that these same nerves that are irritated, these same nerves that are sending these pain signals, are the same nerves that are innervating organs, that are making organs work, whether it be your bladder, your colon, your reproductive organs, your prostate. And so when we just nerve block it, or we medicate it, or we surgically fuse it, we're not addressing the nerve issue, which is the true cause of the problem. Because these nerve problems, when you shut down nerve supply to an organ or a tissue, say your colon, your bladder, reproductive organs, these organs will start to deteriorate. They'll start to become diseased. Just like, think about this, if you tied a rope around your wrist, your hand would start to die off. It would be a matter of hours before you lost sensation, before you lost function, and it would be just a matter of days before you start to realize that your hand is deteriorating. It's rotting off. It's actually causing tissue damage. You're not going to have anything there but rotten tissue and skeleton. And if it continues, you're just going to have nothing but bones hanging there. And I'm not trying to sound graphic, but you need to understand what's really going on here. You can't just band-aid this. You can't just put creams, lotions, shots, potions, pills on it. You actually have to remove the interference to let life flow back in. So when you press on the nerves, when you shut down the nerve supply to any of these organs, you are shutting down life energy to them, which is now going to cause them to become diseased. And that's the biggest problem. We can't have that when you're just trying to mask things and treat the pain. Does that make sense, guys? So what we want to do is we want to look at the best solution to how to fix your problem. Well, first we need to realize really where is it coming from? What is the basic underlying cause of this? Because if you can fix that, if you know what that is, then you know how better to address this problem. The basic underlying cause, guys, is something that we call as chiropractors vertebral subluxation. And what that means is that the vertebrae in your spine have actually misaligned, and when they misalign, they're actually causing nerve damage. So when the bones in your spine misalign, they pinch the delicate nerves right here. And when those nerves are pinched, once again, that shuts down where that nerve goes. So is the solution to that just mask it with a Band-Aid? Just mask it with a medication? Just put some needles so that you don't feel the pain anymore? Do a nerve block or screw it together? Or does it make sense that when these delicate nerves are exiting the spinal column right here, and the nerves are being compressed by the hole closing. See, there's a hole right there between the vertebra. And when that hole is closing off, that hole pinches the nerve. That shuts down the nerve. Now, you may feel it, you might not. The reality is 90% of the nerves in your body do not perceive pain. They make things function. Only 10% of the time you'll feel the problem. So many times you might have a low back issue, never know it, but meanwhile the nerve to your colon is being shut down, causing colon disease, causing colon cancer. You may experience it as constipation all your life or diarrhea. You might have Crohn's disease, ulcerative colitis, but you're not realizing that is because the messages coming from the brain down through your spinal cord, out through these nerves to the organ is not getting there properly. So it's not just about treating the pain and getting rid of the pain. I cannot stress this enough. It's about relieving the pressure off the nerve to allow that nerve to transmit the healing messages to tell your organs how to work. That's more important. So subluxation, as I was saying, is when these nerves are irritated. And they're irritated because these holes are closing off. And guys, if this isn't corrected, it's going to lead to a degenerative state, where you start to see disc decay and disc deterioration. And that's the more chronic state. It has to go through many stages before it gets to this. So if you ever came in our office and I saw disc deterioration, what I mean by that is instead of the vertebra looking nice and full like this, to where the discs are full, the vertebrae are separated, the nerve has plenty of space. Instead, what happens is we start to go through these degenerative changes where this decay is happening, and what we're seeing instead is this, these bone spurs. You see how these bones, it's called lipping and spurring, osteophytes. These bone spurs are razor sharp. They can cut into these nerves, they can irritate the nerves, and that is the bigger problem. Because when it starts to go through these degenerative changes where you see these spurs, that's when the problem is more serious. Now your spine is actively decaying or deteriorating. And if it's not corrected here, you're going to go into a later stage where now you have bone on bone, where there's no disc anymore, the nerve is completely crushed, and of course this is completely shutting down where this nerve goes. That's when you see severe cases of, ulcerative colitis, Crohn's disease. In the low back, it can affect anything from bladder. You could have bladder cancer, colon cancer, because, guys, you're shutting down the nerve impulses. And so what this looks like on actual x-ray is this. Once again, this is what normal disc spacing looks like. The vertebrae are normal here, but we start to see this wear and tear. We start to see bone spurs and disc bulges. We start to see narrowing between the vertebrae. And if you notice, these holes where the vertebra, or the nerves I should say, exit from, they're starting to close off. And like I said, if those close off, what's happening to the organs? Right, they're becoming diseased, they're shutting down. And if it gets continually worse to where now, once again, we're in this stage right here where you have some spacing left and you continue to where you have no spacing, now we're in this stage. And that's when it becomes very, very serious. Because at this stage, you start to lose function of organs. You start to lose maybe bladder control, colon control. You might actually start getting atrophy of the muscles. Patients will come in our office with foot drop. If you experience foot drop, you know what I'm talking about. Where the muscles on the front of your leg, your lower leg, are not getting nerve supply anymore, and as a result the muscle is atrophying and you can't pick your heel up to step normally. And what ends up happening is your foot drags on the ground and you toe drag and you trip. Okay, and that can lead to hip fractures. But instead what you try to do is you try to lift your foot way up and way up, so that way you can clear your foot off the floor and you're very conscious of where your foot is going. And so that's foot drop, guys. And we see when you get into this later stage, the first thing you might notice is something called paresthesia, which means abnormal sensation. If that's not corrected, you're going to start to lose muscle strength. You might start to notice your leg gives out. Or even if it's in the neck, you might start to notice your grip strength is decreasing. If it goes beyond that stage and you continue down this road, you're going to end up to where now you have muscle atrophy. And by the time the muscle's atrophying, now guys, you're in late stage deterioration. They probably are going to recommend surgery. And I might even say it's okay at that point. But if we can stop you here, doesn't that make better sense to keep you from getting to that point? And we've had patients come in with drop foot. We've had patients come in with severe sciatica. We've had patients come in that were ready for the knife. They were set. They were ready to go under the knife and have surgical fusion done, and we kept them from doing that. We were able to help them to reverse this process to get it as close back to normal. Now, we can't get this back to this. I can't get the spacing between the bones to come back to normal. But if we can stop it in this stage or improve it and keep you from getting to this stage to where there's no spacing at all, that's what's worth it. So this is Steve, one of our patients. And when I started working on Steve, I met him at a senior health fair. And he was walking by me and he was all hunched over. And I said, Steve, I said, sir, maybe I can help you out. And he goes, no, I don't think so. I don't think, I'm too far gone. I don't think you can help me at all. And I started talking with him and he stopped and he ended up coming in our office. And Steve was in the military. He used to jump out of helicopters. He used to say they came in low and slow, and he would jump out 6, sometimes 10 feet down onto the ground in Vietnam during the war with a backpack on. So he'd have 40, 50 pounds strapped to his back, and every time he impacted the ground, it jarred his low back. Well, he went to the doctor, and what they found was he had a severe stair step here where these vertebrae don't even line up. They're so far apart that the spinal canal doesn't even line up. So they went in and surgically inserted these screws to try to stop the degeneration and hold his spine. But he was still in extreme pain. He still did what the doctors were telling him to do, but now he could potentially end up on different medications for life, like OxyContin, oxycodone, and who knows how addictive they would have been. Instead, he came in our office, and within 1 month's time, we had him to where he was virtually out of pain. He would take car trips. He would drive on Thanksgiving to visit his family. He'd say he would drive 10 hours. He was able to drive the whole time and not have to get out and walk every hour. He said, you gave me my life back. And instead of getting and needing more surgery, because many times when you have one surgical area fused, you're looking at the next area. The next area is going to need it too, because now that disc wears out also. Instead, he's now working out with a personal trainer again. He's loving life. He hasn't worked out in 15 years, and now he's working out on a Bosu ball. And if those of you who don't know what that is, that means bottom side up, basically. So you see those balls that are a flat side and a rounded side. He's on those working with balance now, which I think is incredibly advanced for someone close to 70 years old. In fact, it's advanced for most of us. But now he's enjoying life again, all because we were able to find the areas in his spine that were degenerating and align it better. It's all about the alignment. When you align it, does not make sense that you take the pressure off the nerve, the body starts to heal better, it starts to feel better, and it starts to function better. And more importantly, those organs work better. So how do we do this? Well, with something called an adjustment. We do chiropractic adjustment. This is exactly how I adjust Steve. So when he comes in, he lays flat down on a table. I locate on his spine, just like this, where the area I'm going to work. And in his case, I had to work a little higher up because I couldn't work right at that fused level. And I started working around it, and I started adjusting him right over in here. And I would bring that area forward and align the spine better so that way those holes right on the side, right here, these holes would open up. And when they opened up, they relieved the pressure off the nerve. And like I said, guys, I know sometimes you're looking for any kind of cure. And I've used essential oils before. But oils are not going to open up that nerve canal. Acupuncture are not going to open up the nerve canal. Massage is not going to open up the nerve canal. Physical therapy does not either. You've got to do something that aligns the spine, that actually fixes the alignment and the mobility to allow that disc and the nerves and the vertebra to come back into a normal alignment. And by doing that, his life is restored. His health is better. I saw this with patients with cancer too. When Dave came to our office, he was about to go to Canada, have a procedure done that was $25,000 to $30,000. He said, listen, if you don't help me, that's where I'm going, but I'm willing to give this a try. I said, well, come in our office. Let's check you out. Let's do an evaluation. We checked him with x-rays. We did a spinal exam. We did something called surface electromyography, which means it's very similar to an EKG, except we put those same kind of sensors on his back, and we're measuring the nerve impulses. And we found subluxation. We found the misalignments in his spine that were pinching the nerve, that were shutting down the nerve supply to his prostate. So he started getting adjusted. Within no time, within 2 months, his PSA level, and that's prostate-specific antigen, so you know what that means. It's the level that doctors measure to know if you have prostate problems or not. Normal is 0 to 4. His was 12.23. His was 300% higher than it was supposed to be. So of course he had cancer as a result of it. Of course he wanted to spend the $25,000 to $30,000 to get this problem fixed, even though we had to go to Canada for it. But instead he came in the office. Within 2 months, we had his PSA level at 5.2. Now it gets better. Within 10 months, he went to his doctor, got his new doctor's report, and over here the doctor wrote 3.04 normal, back to normal. And he was still a smoker. He didn't even stop smoking. But what did we do? We opened up the nerve canals right here so that the nerve was freed up, so it sent healing messages back to his prostate. Think about it. If you're on your cell phone and you're speaking to your significant other, and they're telling you to pick up something at the grocery store, and all you're hearing is, hey, can you get 2 and get 3 or so and get about a dozen? You're thinking, I don't know what you're talking about. I didn't get the message. The message was scrambled. When you compress these nerves, you scramble the message. The brain sends the messages down. The messages come out here, go to the organs, and they are scrambled. The organs do not know how to work. So just like if you cut the nerve to the prostate, it doesn't work. If you pinch the nerve to the prostate becomes diseased. So that's how it works. And once again, remember I said, every single organ is attached to a nerve. It has to have normal nerve supply to work. So this is the bigger issue. And not to sound graphic, but it's the truth. I got to get tough with you guys, a little tough love here. Nobody dies from pain. Now it's not comfortable, and yes, maybe over long term, it wears you down. But the bigger issue is people die from organ issues. That's why you cannot just simply band-aid this problem with acupuncture, although it's good, with massage, with physical therapy, with just ice, with Bengay, with icy hot, whatever it may be. You've got to actually fix the problem. And if guys, like I said, if this is making sense to you, please like, share, comment, and subscribe. Let me know what your thoughts are. Let me know if this makes sense. So like I said, like, share, comment, and subscribe. Let me know how this has affected you. Let me know the key points you got out of this video, what you like the most. Or let me know what you've done in the past that didn't work. And if you're going to a chiropractor, let me know if that's working for you now too. So guys, I hope you liked the video. I love and appreciate you. Dr. Nick signing off. Thank you so much. Have a blessed day. Take care.